Fatty liver, a condition characterized by the accumulation of excessive fat in the liver cells, has emerged as a silent epidemic in modern health. Often referred to as the silent disease, fatty liver can progress undetected, posing a significant threat to overall well-being. As a prevalent health issue, it is crucial to understand its nature and implications to combat this hidden danger effectively. Fatty liver, also known as non-alcoholic fatty liver disease, NAFLD, is a condition that can occur in individuals who consume little or no alcohol. It is a manifestation of an underlying metabolic disorder, where the liver's ability to break down and metabolize fat becomes impaired. This accumulation of fat within the liver cells can lead to inflammation, scarring, and, in severe cases, liver failure. The true threat of fatty liver lies in its insidious nature. Unlike many other health conditions, fatty liver often exhibits no apparent symptoms in its early stages, making it challenging to detect and address promptly. By the time symptoms become noticeable, the condition may have already progressed to a more advanced stage, potentially leading to severe complications. Understanding the causes of fatty liver, lifestyle factors and underlying health conditions. The development of fatty liver is influenced by a combination of lifestyle factors and underlying health conditions. Among the primary contributors are obesity and overweight. Excess body weight, particularly abdominal obesity, is closely linked to the accumulation of fat in the liver. The excess fat stored in the body can overwhelm the liver's ability to process it effectively. Insulin resistance. Insulin resistance, a condition where the body's cells become less responsive to insulin, is a significant risk factor for fatty liver. This metabolic disorder can lead to an imbalance in fat metabolism, contributing to the buildup of fat in the liver. Unhealthy diet. A diet high in saturated fats, refined carbohydrates, and added sugars can increase the risk of developing fatty liver. These dietary factors can contribute to weight gain, insulin resistance, and metabolic imbalances. Sedentary lifestyle. A lack of physical activity and prolonged periods of inactivity can exacerbate the risk of fatty liver. Regular exercise helps maintain a healthy metabolism and promotes weight management. Genetic factors. Certain genetic predispositions can increase an individual's susceptibility to developing fatty liver. Familial patterns and genetic variations can influence fat metabolism and the liver's ability to process it effectively. Underlying health conditions. Conditions such as type 2 diabetes, metabolic syndrome, and polycystic ovary syndrome, PCOS, are closely associated with an increased risk of fatty liver development. Symptoms of fatty liver. How to identify if you have it in its early stages. Fatty liver often remains asymptomatic, making it challenging to detect without proper medical evaluation. However, as the condition progresses, some individuals may experience the following symptoms: fatigue and general weakness, discomfort or dull pain in the upper right abdomen, where the liver is located, unexplained weight loss, loss of appetite, nausea and vomiting, abdominal swelling or bloating. It is important to note that these symptoms can be nonspecific and may also be indicative of other health issues. Therefore, it is crucial to consult a healthcare professional for proper evaluation and diagnosis. The link between fatty liver and other health issues, diabetes, obesity, and cardiovascular disease. Fatty liver is not an isolated condition. It is closely intertwined with other significant health concerns. The presence of fatty liver can increase the risk of developing or exacerbating the following conditions. Type 2 diabetes. Fatty liver and type 2 diabetes are closely linked, as insulin resistance plays a central role in both conditions. Individuals with fatty liver have an increased risk of developing type 2 diabetes, and those with diabetes are more prone to developing fatty liver. Obesity. Obesity and fatty liver often coexist, creating a vicious cycle. Excess body weight can contribute to the accumulation of fat in the liver, while fatty liver can also lead to metabolic imbalances that promote weight gain. Cardiovascular disease. The presence of fatty liver has been associated with an increased risk of developing cardiovascular diseases, such as heart disease and stroke. The underlying metabolic disturbances and inflammation associated with fatty liver can contribute to the development of atherosclerosis and other cardiovascular complications. Metabolic syndrome. Fatty liver is considered a component of metabolic syndrome, a cluster of conditions that includes abdominal obesity, high blood pressure, elevated blood sugar levels, and abnormal cholesterol levels. This combination of factors significantly increases the risk of developing cardiovascular disease and type 2 diabetes. Diagnosing fatty liver. Tests and procedures to confirm the condition. Diagnosing fatty liver typically involves a combination of medical history evaluation, physical examination, and diagnostic tests. The following procedures may be employed. Blood tests. Blood tests can help assess liver function and detect elevated levels of liver enzymes, which can indicate the presence of fatty liver. However, it is important to note that some individuals with fatty liver may have normal liver enzyme levels. Imaging tests. Imaging techniques such as ultrasound, computed tomography, CORT, scans, or magnetic resonance imaging, MRI, can provide visual evidence of fat accumulation in the liver. These tests can help confirm the diagnosis and assess the severity of the condition. Liver biopsy. In some cases, a liver biopsy may be recommended to obtain a small tissue sample for further analysis. This invasive procedure can provide valuable information about the extent of fat accumulation, inflammation, and potential scarring, fibrosis, in the liver. It is important to consult with a healthcare professional and undergo appropriate diagnostic tests to accurately determine the presence and severity of fatty liver. Treatment options for fatty liver. Lifestyle changes, medications, and surgical interventions. The treatment approach for fatty liver typically involves a combination of lifestyle modifications and, in some cases, medications or surgical interventions. The specific treatment plan will depend on the severity of the condition and the presence of any associated health issues. Lifestyle changes. Weight loss. Achieving and maintaining a healthy body weight through a balanced diet and regular exercise is crucial for managing fatty liver. Even modest weight loss, 5–10% of body weight, can significantly improve liver health. Dietary modifications. Adopting a diet low in saturated fats, refined carbohydrates, and added sugars, while incorporating more fruits, vegetables, whole grains, and lean protein sources, can help reduce fat accumulation in the liver. Exercise. Regular physical activity, such as aerobic exercise and strength training, can improve insulin sensitivity, promote weight loss, and reduce the risk of fatty liver progression. Medications. Insulin sensitizing agents. Medications like metformin and thiazolidinediones, TZDs, can help improve insulin sensitivity and reduce the risk of fatty liver progression in individuals with insulin resistance or type 2 diabetes. Vitamin E. In some cases, vitamin E supplementation may be recommended to help reduce inflammation and oxidative stress in the liver. Surgical interventions. Bariatric surgery. For individuals with severe obesity and fatty liver, bariatric surgery, such as gastric bypass or gastric banding, may be considered as a treatment option. These procedures can lead to significant weight loss and improvement in fatty liver disease. It is crucial to work closely with a healthcare team, including a gastroenterologist, hepatologist, or liver specialist, to develop a comprehensive treatment plan tailored to individual needs and circumstances. Preventing and managing fatty liver. Diet, exercise, and healthy habits. Preventing and managing fatty liver requires a multifaceted approach that incorporates dietary modifications, regular physical activity, and the adoption of healthy lifestyle habits. Here are some key strategies. Maintain a healthy weight. Achieving and maintaining a healthy body weight through a balanced diet and regular exercise is essential for preventing and managing fatty liver. Adopt a liver-friendly diet. Focus on consuming a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, such as those found in nuts, avocados, and fatty fish. Limit your intake of saturated fats, refined carbohydrates, and added sugars. Stay active. Engage in regular physical activity, aiming for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Incorporate a combination of aerobic exercises and strength training for optimal results. Manage stress. Chronic stress can contribute to metabolic imbalances and exacerbate fatty liver. Practice stress management techniques such as meditation, yoga, or deep breathing exercises to promote overall well-being. Limit alcohol consumption. Excessive alcohol intake can further damage the liver and accelerate the progression of fatty liver disease. If you consume alcohol, do so in moderation or consider abstaining altogether. Maintain healthy sleep habits. Adequate sleep is essential for overall health and can help regulate metabolic processes. Aim for 7–9 hours of quality sleep each night. Seek professional support. Work closely with a healthcare team, including a registered dietitian, to develop a personalized plan for preventing and managing fatty liver. Regular checkups and monitoring can help track progress and make necessary adjustments. By adopting a comprehensive approach that combines a healthy diet, regular exercise, and lifestyle modifications, individuals can significantly reduce their risk of developing fatty liver or effectively manage the condition if already present. The role of nutrition in fatty liver. Foods to include and avoid nutrition plays a pivotal role in the prevention and management of fatty liver disease. By making informed dietary choices, individuals can support liver health and promote overall well-being. Here are some guidelines on foods to include and avoid. Foods to include: fruits and vegetables. Incorporate a variety of colorful fruits and vegetables, which are rich in antioxidants, fiber, and essential nutrients that support liver function. Whole grains. Choose whole grains like brown rice, quinoa, and whole wheat bread, as they provide fiber and complex carbohydrates that help regulate blood sugar levels. Lean proteins. Opt for lean sources of protein, such as fish, poultry, legumes, and tofu, which provide essential amino acids for liver health without contributing excess fat. Healthy fats. Include healthy fats like those found in avocados, nuts, seeds, and fatty fish, such as salmon and mackerel, which can help reduce inflammation and support liver function. Green tea. Green tea is rich in antioxidants and has been shown to have potential benefits for liver health, including reducing inflammation and improving fat metabolism. Foods to avoid or limit. Processed and fried foods. Limit your intake of processed and fried foods, which are often high in unhealthy fats, sodium, and additives that can contribute to liver inflammation and weight gain. Refined carbohydrates and added sugars. Minimize your consumption of refined carbohydrates, such as white bread, pastries, and sugary beverages, and added sugars, as they can contribute to insulin resistance and exacerbate fatty liver disease. Saturated and trans fats. Reduce your intake of saturated fats, found in fatty meats, butter, and full-fat dairy products, and trans fats, found in many processed and fried foods, as they can promote inflammation and worsen fatty liver disease. Alcohol. If you consume alcohol, do so in moderation or consider abstaining altogether, as excessive alcohol intake can further damage the liver and accelerate the progression of fatty liver disease. Remember, a balanced and nutrient-dense diet, combined with regular physical activity and a healthy lifestyle, can play a crucial role in preventing and managing fatty liver disease. Support and resources for individuals with fatty liver. Organizations, online communities, and educational materials navigating the journey with fatty liver disease can be challenging, but you are not alone. There are various organizations, online communities, and educational resources available to provide support, guidance, and reliable information. Organizations and foundations. The American Liver Foundation, ALF, the Fatty Liver Foundation, the Global Liver Institute, the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. These organizations offer educational materials, support programs, and resources for individuals with fatty liver disease, as well as their families and caregivers. Online communities and support groups. Social media platforms, e.g., Facebook, Twitter, Instagram, host various groups and communities dedicated to fatty liver disease, where individuals can connect, share experiences, and offer mutual support. Online forums and discussion boards, such as those hosted by organizations like the ALF or NIDDK, provide a space for individuals to ask questions, share insights, and learn from others facing similar challenges. Educational materials and resources. Reputable websites and online portals, such as those maintained by government agencies, e.g., NIDDK, Centers for Disease Control and Prevention, medical associations, and academic institutions, offer reliable and up-to-date information on fatty liver disease, including research findings, treatment guidelines, and lifestyle recommendations. Books, e-books, and podcasts authored by healthcare professionals, researchers, and individuals with lived experiences can provide valuable insights and practical advice for managing fatty liver disease. Healthcare professionals. Consult with a multidisciplinary team of healthcare professionals, including gastroenterologists, hepatologists, registered dietitians, and other specialists, who can provide personalized guidance and support throughout your journey with fatty liver disease. By leveraging these resources and seeking support from knowledgeable professionals and communities, individuals with fatty liver disease can access the information, guidance, and encouragement needed to navigate their condition effectively and improve their overall well-being. Conclusion. Raising awareness and taking action against fatty liver disease has emerged as a silent epidemic in modern society, posing a significant threat to public health. While often overlooked or undetected, this condition can have far-reaching consequences if left unaddressed. By raising awareness and taking proactive steps, we can combat this hidden danger and promote better liver health for all. It is crucial to recognize the multifaceted nature of fatty liver disease, which encompasses lifestyle factors, underlying health conditions, and genetic predispositions. Adopting a comprehensive approach that combines a balanced diet, regular physical activity, and healthy lifestyle habits is paramount in preventing and managing this condition. Moreover, seeking timely medical attention and undergoing appropriate diagnostic tests are essential for early detection and effective intervention. By working closely with healthcare professionals and leveraging available resources, individuals can develop personalized treatment plans tailored to their specific needs and circumstances. If you suspect you may be at risk for fatty liver disease or have concerns about your liver health, don't hesitate to consult with a healthcare professional. Early detection and proactive management can make a significant difference in preventing the progression of this condition and protecting your overall well-being. Take action today by scheduling an appointment with your doctor or a liver specialist to discuss your risk factors, undergo necessary tests, and develop a comprehensive plan to address any potential issues. Remember, your health is a precious asset, and taking proactive steps can empower you to lead a healthier and more fulfilling life. By raising awareness, promoting education, and fostering a collaborative approach among individuals, healthcare providers, and communities, we can collectively tackle the hidden threat of fatty liver disease. Together, we can pave the way for a healthier future, where liver health is prioritized, and the silent epidemic of fatty liver is no longer a silent burden.